all for joining us for this part 2 in this webinar series on working with Minnesota local governments to increase access to healthy food, and also to really thinking about the relationship between local government decision-making and activities with different public health initiatives. Today's webinar is going to be really focused on local community planning and how health and local planning are related, and some of the issues and opportunities that come up with local planning and opportunities for partnership with public health. So I am going to be moderating today's webinar. My name is Mary Marrow, and I'm a staff attorney at the Public Health Law Center. I've had the opportunity, I'm sure, to work with quite a few of you who are on the phone through different initiatives. The Public Health Law Center provides support to public health allies and advocates around the state and around the country through the Minnesota Department of Public Health Statewide Health Improvement Program, through Blue Cross Blue Shield Center for Prevention, and also through some other initiatives. Also, we have a current initiative with the University of Minnesota Extension through the SNAP-Ed Community Partnership Project. Today's webinar is being very bad echo. All right, apologies for that. I'm not quite sure what just happened. Today's webinar is being supported by a contract that the Public Health Law Center has with MDH and in supporting statewide health improvement programs grantees. The webinar today is also in a partnership with some great speakers that we have through the Arrowhead Regional Development Commission, MDH, and Blue Cross Blue Shield Center for Prevention. For those of you who aren't familiar with the Public Health Law Center, we are located at Mitchell-Hamlin School of Law in St. Paul, and we provided, as I said, legal technical assistance to different grantees and public health partners around the state. We do not provide direct client representation, and we do not lobby, but we do support communities around the state around legal research needs, the development of policy, developing publications, and also doing trainings and webinars like today. Our first speaker today is going to be Ellen Pillsbury, who is the active transportation coordinator with the Minnesota Department of Health, and I think is expanding her work in planning to encompass also food access issues. Ellen works within the Office of Statewide Health Improvement Initiatives, focusing on community active living strategies and working with local public health, regional, and state partners on active transportation and planning efforts to create more walkable and bikeable communities. Ellen has over 9 years of experience in regional planning and has a master's degree in urban planning from Minnesota State University, Mankato. Our next speaker will then be, our next speaker will be Andy Hubley, who is with the Arrowhead Regional Development Commission, and he's the director of the Regional Planning Division there. The Arrowhead Regional Development Commission is a regional development organization serving 7 counties in northeastern Minnesota. Andy has been with the Development Commission since 1997 and leads ARDC's efforts in rural and small urban land use and transportation planning. And he has a lot of experience with strategic planning, environmental review, geographic information systems, economic development, and recreation planning. Andy has a BA in geography from the University of Minnesota Duluth. And then our final speaker today is going to be Eric Weiss, a community health planner with the Center for Prevention at Blue Cross Blue Shield of Minnesota. Eric is a city planner by trade, and he works with and supports projects across the state with a focus on the intersections of health, equity, and community development. He founded and operated a farmer's market and community garden in his community, and also worked to bring a full-service grocery store to his neighborhood in South Minneapolis. Eric holds a master's in urban planning from Minnesota State University in Mankato. And all 3 of our speakers are certified by the American Institute of Certified Planners and just bring a wealth of information and experience to this conversation today. I think we're going to learn a lot and benefit from their involvement. So today, for the goals for this presentation are to really try to provide some context for the relationship between planning and public health. And we're going to start by exploring some of the historical relationship between public health and planning, and then talk about how that that evolution between some of the historical roots of the relationship between public health and planning with the current planning efforts going on around Minnesota in the metro area and around the state, and look at how the planning as a field is kind of evolving to address some of the present-day public health priorities and challenges that we have. In addition, today we're going to be talking some about the differences between planning in the Twin Cities metro area and in other parts of greater Minnesota. And then we're also going to identify opportunities looking into the future for local planning to address future needs of Minnesota communities and different public health issues that may arise. And one of the things when we're talking about some of planning and public health efforts is it's just really important for us always to remember that not all Minnesotans have the same access to resources and to some of the public health benefits as far as longevity and prevalence of chronic diseases as others. And so it's really important that we keep in mind how different initiatives may impact different populations who may be experiencing health disparities and may need to have additional resources or focus to make sure that we all get to share in the benefits of our public health awareness and the opportunities that are available here in Minnesota. So with that, I am going to turn this webinar over to Ellen.
Good afternoon, everybody. Thank you for joining us today. I am going to provide a brief history. Basically, I'm going to try and provide you with the highlights of public health and urban planning, just to give a sense of how these professions were formed out of the necessity. Some of the first maps, some of the first city planning really in the United States looked at the cities of Washington, D.C. and the New York City street layout. And the main, basically these early days of like 1791 and 1811 was really based on built environment, street grid, and kind of providing some of the first plans for how a city could organize, not necessarily looking at how people would interact in those communities or live in those communities, but just how it could be organized. And this is basically the beginning of the industrial revolution and the rapid population increase of our cities. So, and that was where kind of the rapid population growth of our communities. People were living in those street grids, but maybe living next to their workplaces, which could be smoky industrial plants, or just other work environments that not necessarily weren't regulated yet for their kind of how they impacted the residents living around them. So as people were moving into the cities, there was poor sanitation. There was clean water was a problem. There was cholera, other communicable diseases that public health and planning professions were beginning to recognize and starting to think about how to address. And this chart shows how in the 1900s, that area when our cities were populated, our leading causes of death were communicable diseases, and it was just, our main issue and why, how we formed our profession. Looking at now in 2010, where we now need to address chronic disease, which is kind of where we're going. But so one of the first symbols that really showed how the built environment impacted people and infectious disease was this mapping of cholera in 1854 in the city of London. This was groundbreaking information that showed this link and just really helped spur the growth of public health and the need for kind of more data collection and more understanding of how people are impacted by the built environment. And within the United States, American cities are becoming more and more urbanized. In basically a generation, 70 years, we saw our cities grow, tenfold, which really showed how I need to address how our city environments are making them healthier and working on infectious disease. Within the planning field, one of the first city parks was planned was Central Park in New York City in 1853, and it worked, 1858, and it worked. It came out of the need because of our congested city, like New York City. It provided people with green space, a place to walk, physical activity. It was one of the first, park plans out there that really modeled how a city could carve out a space and kind of master plan a park for their residents to help them get away from their tight living quarters and also their kind of their industrial working areas. And then a big landmark or moment for public health and using the New York City metropolitan area was the Board of Health was formed in 1865, and it came out as part of a pivotal report that came out on the New York City's sanitary conditions, describing how housing and morals and health were all intertwined, and described some of the kind of recommendations for the future. And that report helped form the Board of Health for this city, and then which then in 1872 the American Public Health Association was formed to look at chronic disease and water pollution sanitation at kind of at a national level. And then in 1885, the American Planning Association published the standard methods for examination of water and sewage, which helped a lot in providing some guidance to cities on how to how to plan and how to kind of develop their systems to create better health and sanitation. And when we look at housing, where people were living, and then the air and water. There was a major housing reform, and one kind of touchstone was that when How the Other Half Lives was published. This provided, this really helped stimulate kind of housing reform and trying to make housing conditions better for all of those living. The book was based on the slums of New York City, but helped provide, highlight the issues around housing and the need for healthier housing. And then within New York City, it was right around that time, there was a tenement, there's a landmark law kind of restricted tenement buildings to 1.5 times the street width, and also provided some guidance on height restrictions for builders. So people, there was more light and buildings were shorter, providing more light kind of on the street. And then the New York State passed a fairly landmark act, one of the first laws banning construction of poorly ventilated, dark tenement buildings within the state. And one of the big landmark parts of this tenement law was that new buildings must be built with outward-facing windows in every room, an open courtyard, proper ventilation systems, and indoor toilets and fire safeguards. Major reform that rippled kind of throughout the United States. And this just shows, this law basically meant that there was now what's called the dumbbell floor plan. So you can kind of see where there's air shafts, there's light. This was, this was meant to help bring more air and light to the overcrowded city tenements. And the next big piece of law around how making places healthier for people to live was the first zoning resolution, which mapped out height restrictions, the use of a building, the size of the building, the density of the buildings around. This is meant to kind of protect or promote affordable housing and to protect places of historical significance, kind of through the zoning, and having and providing, a city the right to zone, kind of help promote public health in that it looked at where uses were in relation to each other. So people didn't need to live as next to industrial zones. And then kind of in the late 1800s, there was, this is pretty monumental, there was a garden city movement where it looked at, planners started to design cities that had more green space, that had separated the kind of commercial industrial uses from where people were living. So you can kind of see the ad on the right side. It says, "This is how we're living today," kind of working and living with the smoke. Then, maybe today we're living in the suburbs or living in the suburbs and working in the smoke, and then maybe living in a greener space. So there was a recognized need that people's built environment affected their health, and this was one of the first movements to help create a healthier community or healthier place for people to live. One of the first, this is an advertisement for one of the first cities that was built in this way. It was in 1803, and it was advertised as built with a goal for healthy built environments and for people. And this community, garden city communities were built in, kind of began in England and then kind of moved their way into the United States. And then the first major regional plan was done in the United States in the Chicago area, and this was new. America hadn't been thinking about regional planning before, but in this plan it looked at 6 kind of major physical environments in the area, looking at developing a highway system, freight and passenger railway systems, looking at the outer park system, systematic streets, and then creation of a civic center, a cultural institution, and government. So this is a major keystone regional plan model that was first started in Chicago and then moved throughout the United States. And this was also the year that the American Planning Association, American Public Health Association published its standard methods for examination of air. So that's two key milestones in this year. More regional planning, but planners understanding that what's being done in one city impacts its neighboring communities, and the realization that we need to start measuring how our air quality is impacting the public. And then two key acts that came out of the Department of Commerce in the mid-20s was both the City Planning Enabling Act and also the Zoning Enabling Act. Both these acts provided states and cities the ability to adopt zoning regulations and planning and work on planning in their communities. Let's see. And then the first city to officially adopt a city plan was the city of Cincinnati, Ohio, in 2025. Kind of some of the key pieces about the first plan is that its goal was to kind of foresee and make provisions for those things which shall increase the public health, safety, convenience, comfort, prosperity, beauty, and general welfare of Cincinnati. So one of our first city plans in the United States did strive to increase public health, and then it did look at a few big big public projects around a viaduct, which you can see here in the picture, and then recommendations for utilities and subdivisions. So from the first city plan in 1925, and now we're just about almost 100 years out from that. Public health and planning has we've addressed infectious disease, and now we're working towards chronic disease. And in that time, we've seen cities change through federal programs, transportation, highway programs, housing, economic development, a number of kind of programs and just movements in planning and public health that have brought us to a time where we are now thinking about how we can plan for our communities to better address health and these chronic disease risk factors that we have. So that gives you a brief background of planning and public health directions. I'm now going to, I think, hand it over to Andy Hubley, who can talk about some work going on in Greater Minnesota to address health and planning.
Thank you, Ellen. Again, Andy Hubley with the ARDC, the Arrowhead Regional Development Commission, and I'll talk about health and comprehensive planning as we're working with it today. Just a quick background, ARDC is one of 11 regional development organizations in Minnesota. They cover nearly every corner of the state, and we are primarily planning organizations helping communities implement visions and providing technical assistance to do so. We cover here at ARDC the 7 counties in the tip of the Arrowhead of Minnesota. So Ellen talked about city planning, zoning, how it grew out of health, and a lot of the initial things were addressed now in building codes. Then it got into separation of uses, keeping unpleasant things away from where people live and other places where they shop, et cetera. And now we're to kind of our modern era where we're kind of taking a look at health again in a pretty close way. So comprehensive planning is a long-term vision for a community. It's pretty simple. What do you have today? Where do you want to be in the future? And what actions can you take to get there? And you write it all down in a big document. It's really a public participant-friendly process, and the intent is to address current issues and also kind of foresee future issues that also will need to be addressed. So why comprehensive plan? In a lot of ways, originally we talk a lot about preserving things. Up here we have things such as iron ore. Other places have a lot of agricultural land, and comprehensive plans in many communities are looking at how to preserve that. If you have a resource, you need to keep it for your community's well-being, for a region's well-being. The comprehensive plan can suggest and use public input to seek ways to preserve those things. We talk about identifying issues. We talk about property rights. Sustainability is a big thing that we talk about nowadays. Is feasibility, cost. You know, we want these things. What's it going to cost? And what's it going to cost to maintain those things in the future? And this is really the time in a community where you get to look ahead 20 years and say, what do you want your community to be in 20 years? A couple of big things when it comes to comprehensive planning. Comp plans serve as a community's base for their zoning code. In the metro area, this is a requirement. It is not a requirement in outside the metro area in Minnesota, but most communities still and counties still undertake the process. If you have a zoning dispute, in a lot of cases, most cases even perhaps, the court system will be looking at what does the comp plan say, even before they look at what the zoning code says. If there was a publicly vetted comprehensive plan that says a piece of property or an area should be this, and the zoning code does not reflect that, oftentimes the judge will look at the comp plan as the ruling document that needs to be followed. It's also important to know that comp plans are the primary time for public input. You have zoning changes that are requested, and there's public hearings and things like that. But that's often reactionary, and people are reacting to specific things. Whereas in the comprehensive plan, that is really the time for the public to state what they want their community to be like, and it's the public's chance to get their words heard by the City Council, Planning Commission, et cetera, as they look into the future. So ARDC itself and comprehensive planning, we've been doing this for probably as long as we've been in existence, since 1969. We have a significant experience working throughout Northeast Minnesota. We primarily work with smaller communities that don't have their own planning staff and oftentimes cannot afford a giant planning contract. And we work with those communities to undergo a process. It's usually 6 to 9 months. There's 4 to 6 meetings. We really stress public participation, and we do a community survey as part of that. And there's always at least 2 public meetings. We do a public visioning session at the beginning that's kind of a brainstorming, wide open canvas type thing. And then we have a public review at the end prior to it being forwarded to the city or the county for adoption. We'll do another public review to see how the people react to what we've come up with. And typically we're using a planning committee throughout those meetings, those 4 to 6 meetings are with a planning committee that sometimes is simply the planning commission, but most of the time is a strategically recruited committee of citizens and stakeholders. So comprehensive planning has grown significantly even in the last 20 years as to what is looked at. I think when I started 20 years ago or so, there was 6 or 7 chapters in a comp plan. We're now oftentimes up to 11 chapters in a comprehensive plan as people want to look at things a little bit differently. Most communities are looking at housing, transportation, land use, economic development, utilities, community facilities, mining, agricultural, natural resources, cultural resources, recreation, parks, and arts. That area has expanded a lot over the years. And we also talk about intergovernmental cooperation. That section has grown a lot over the years as communities look at ways that they can work with other communities to save money or to be a better community through collaboration. At the end, we always provide the community with an implementation checklist that they can check off and review on a yearly basis to see how they're doing with implementing their plan. And then in the end, the plan is proposed to be adopted by the City Council, Town Board, or County Board. So we had a unique opportunity here in the last year and a half. The IRRB, the Iron Range Resources and Rehabilitation Board, the state entity that addresses mineland areas in northeast Minnesota, decided that in order to qualify for one of their grants for infrastructure or similar grants, that a community needed to have a comprehensive plan, an up-to-date comprehensive plan. This was the IRRB's way of ensuring that public input has happened regarding these project ideas that grants are being sought for, and that the community's put some thought into it. What it resulted in is ARDC working on a lot of plans in the last year, working with a lot of small communities to get them planning and to get them qualified for the grants. And it provided an opportunity, as we've been working with health a lot lately in communities, is to look at health inside our comprehensive plans. So we did develop a pilot project, partnering with the U of M and our Community Health Board, known as Healthy Northland here, which works with the State Health Improvement Program, SHIP, working with those folks up in northeast Minnesota. And it was funded by Blue Cross and Blue Shield to do this pilot project. The goals were to create a comprehensive plan that addresses health equity, food access, and healthy eating. So the grant really focused on food access and healthy eating, and to, potentially even influence future projects around those areas, and to create awareness of potential economic benefits. So the project really focused on healthy eating, but it should be noted that we're incorporating health into all the chapters, pretty much in every comprehensive plan now, health in all policies, and we'll talk more about that too. So the 3 pilot communities were the City of Tower and Breitung Township, also known as Sudan. Those 2 communities often work together on projects that are right adjacent to each other. The City of Proctor, City of Mountain Iron, has a plan in progress, and we are going to undertake these activities. So, as an example, the Proctor Comprehensive Plan, we brought the Community Health Board in to present at the Planning Committee meeting about health, the health statistics, health community level importance of health, and different health initiatives that can be undertaken. So that was the first step, is bringing in the health folks right into the meeting and letting them present to the committee. And then talk with meeting attendees about what hinders or enhances health in their community. In Proctor, they talk about a lack of transportation infrastructure, active transportation, walking, biking, sidewalks, that type of thing. You're talking about some physical infrastructure causing blight, talking about some major roadways passing through a community, effectively cutting off the community from each other if you're walking or biking. They talked about what is healthy in Proctor, having doctors, dentists, pharmacies. In a lot of small communities, those types of things are far away, and that's a big deal. We talk about the presence of parks, trees, gardens, and open space. We talk about access to certain active transportation infrastructures and access to a quality education. So those are the things, the types of things that a community can look at. And like I said, we often talk about health in all chapters of a comprehensive plan. We talk about housing goals, and it talks about vacant lots and how we can better use vacant lots in the community, including community gardens. Transportation, active transportation is still a very big part of what ARDC does, and it comes, it shows in our comprehensive plans. We talk a lot about trails, sidewalks, active transportation things, creating destinations, creating connections, and that comes forth in most of the comprehensive plans still. When we get into cultural resources, agricultural resources, people are more in tune with food in communities that we're seeing. So many communities do have farmers markets, even really small ones, and we're talking about opportunities to enhance that through CSAs and other healthy food distribution points. When we talk about land use, we talk about ensuring that the land use policy zoning allows gardens, allows recreation opportunities, and talks about, in this case, if there's a new development, ensuring that green space is a part of every new development, and that green space could include community gardens. We also talk about, under intergovernmental cooperation, the work that the city can do with all the different entities that support healthy living in this part of the state, including the SHIP program, other public health folks, and healthy food advocates. So there is resources out there that communities can take advantage of. Looking further north, Tower and Breitung is a smaller town. It's Proctor is right near Duluth, but Tower and Breitung are quite rural and away from other communities. They understand the asset of having a local grocery store. They want to make sure they continue to have that, and they really have pushed their food shelf interactions. And the farmers market in Tower is actually quite nice and quite large, which is a good thing, and they're going to continue to provide that. Active living again. They talk about education a little bit more in Tower and Breitung, DARE, Farm to School, or other informal programs, so there's a little bit different take on things. And they also talk about a community partnering with the health service professionals to look at the health of a community and how to address it. Mountain Iron's plan is still ongoing. They've talked about their hindering and enabling factors. Mountain Iron is in an active mining area, and that has come into play as to how a community deals with that. There is things that go on from mines that can be perceived as detrimental to health, although much of that has been addressed over the years. And Mountain Iron's a little different too, in that they do have a Walmart, and a Walmart, it's a superstore with the grocery store, and how does that play into the community? They're going to be looking at those types of things. Wanting trail connections. There's a lot of trails around Mountain Iron, but it's actually poorly connected to them in a lot of cases, cut off by highways, and they're going to try to address some of those things. As part of the Blue Cross Blue Shield funded project, we also did a food access survey to those communities, and got a pretty good response rate. And the questions asked about, who the people are, where they do their food shopping, how they get there, and how do they prepare and eat their food, and how do they store it. A lot of people don't realize that it's hard to eat healthy food if you don't have a refrigerator, and things like that. And a lot of the people that we deal with are dealing with things at that level. Right now we're developing they're working with a rural healthy community checklist of looking at how a comprehensive plan can be reviewed, and this would be used by both planners and a public health staff to look at a community and its plans and kind of determine how they have addressed food access and health in their comprehensive plan. Some challenges in lessons learned, there is a bit of a learning curve for planners that haven't dealt with public health issues much in the past, and learning where they can access health data and how they can learn about their community and health needs, and just having planners become more familiar with health issues. And a need to, again, raise awareness about infusing health into a community's vision and planning process. The communities we work with, a couple of them embraced it quite well. Others kind of came along for the ride with some prodding and were a little bit leery of adding health as a subject into their comprehensive plan. And we need to work on that still as to how to get communities to commit to such an endeavor of looking at health in a comprehensive plan. In that vein, what we took away was we need to expand community engagement strategies around health. We need to address how health data is incorporated into a planning process. We need to stay current on planning best practices around food access and learning about current initiatives that are around food access so that we can take advantage of those. And oftentimes, I talk about health in all policies, but most comprehensive plans in the end, a lot of times just talk about active transportation, and we need to work on making sure that it is addressed in all the chapters. So that's my presentation. One thing I didn't mention that I should is that the communities that we're working with have how they are actually addressed in the physical document of their comprehensive plan is different. Some communities have added health into all the other chapters, and other communities have separated it out and had a health chapter. And that's what Tower and Breitung did, was they had their own separate health chapter, which was a neat way to look at things. Comprehensive planning is always kind of goofy because you separate things into chapters such as transportation, land use, or health, but transportation and land use are obviously integrated in so many ways and impact each other, and health is integrated into so many things and is impacted by other chapters, or the subjects of other chapters. So we're always kind of playing around with how the document functions in how it's separated out in the discussion points. And we've done it different ways, and I think that having a separate health chapter is an interesting way to go about it. That is the end of my presentation. I hope I didn't take too long. I will turn it over to Eric.
Eric Weiss with the Center for Hello, this is Eric Weiss with the Center for Prevention at Blue Cross Blue Shield. Today I'll talk to you about metro area planning and where we're at in the planning process for the 7-county region. And then I'll shift into some 21st century planning, building off of what Ellen and Andy shared, and how we can use the comprehensive plan as a document to address our 21st century needs. So within the Twin Cities metro region, we are governed by different laws according to state statute than the rest of the state. And when I speak about the Twin Cities region, it's the 7 counties of Hennepin, Ramsey, Anoka, Washington, Dakota, Scott, and Carver. The way that Minnesota statute is written, all communities throughout the state are enabled or allowed to plan and create a comprehensive plan. Only in the metro region are they required. So how that all operates is the Met Council was established in the 1960s as the area's Metropolitan Planning Organization, or MPO, you might hear. It's a government agency that does have taxing capacity. It's governed by a 16-member body that is appointed by the governor, and the chair of the Met Council is actually a cabinet member. The Met Council, or Metropolitan Council, is there to really oversee issues that are better planned at a regional level rather than a local or county level. So the Met Council oversees issues that include transit and transportation, water and wastewater, regional parks, housing, and then of course planning. So all towns, cities, and counties in the Met Council's jurisdiction must update or complete a comprehensive plan once every 10 years. And the Met Council oversees that process and ensures that local plans are in general compliance with the regional vision. And if plans are not in compliance, the Met Council does actually have the authority to force conformity. And there have been some local instances. Probably the most famous or infamous is a case where Lake Elmo, the city of Lake Elmo, and the Met Council had a disagreement on the vision for the future of Lake Elmo. And that case did actually go all the way up to the Minnesota Supreme Court. And the Met Council won that case, which basically required Lake Elmo to plan for growth at a much higher rate than they had wanted to. They had wanted to stay more rural. So this image shows the regional 10-year planning cycle for the Met Council. And it actually began for this current round back in 2010 when the last census was completed. So oddly enough, you'll see when we get towards the end of this cycle, once we finish this cycle, we actually begin again with the 2020 census. So the data that is gathered from the census really helps to form how the region will plan, as it gives a better indication of where the region is at and where it might go. So with the information from the census, the regional plan is developed, and that currently is Thrive MSP 2040. The last plan was for the year 2030 and 2020. So it's really looking out, 25 to 30 years. Once that regional plan is determined and created, smaller systems and policy plans are created. This includes regional parks, water, transportation, and housing. Those are more detailed chapters. Then in the fall, just last fall, system statements were released, which are documents that are specific to each individual town, city, and county that provide population, job, and household number forecasts for the communities. At the same time, the local planning handbook was released, which is basically what it sounds like. It's the Met Council's guidance to local communities on how they should go about doing their comprehensive planning. Then is the real, so we're in between the local planning handbook release and the system statement release and the December 31st, 2018 deadline. And so this is the opportunity for communities to engage their community, determine a vision, and plan for the future. And so comprehensive plan updates must be submitted to the Met Council by the end of 2018. It's interesting that sometimes there's a soft and a hard deadline. I actually just heard of a community in the Met Council region that just wrapped up its last plan, so its 2030 plan. And so they'll need to go and restart their process right away. What happens on that deadline is the Met Council will then review local plans for alignment to the regional plan. And once they sign off on that, then the local governing bodies, so likely the city council, will actually adopt that plan. So Thrive MSP 2040 is the vision for the metropolitan region for the next 30 years. And it really reflects the concerns and aspirations of the region, anticipates future needs, and addresses the responsibility to future generations. It addresses the fact that as a region, we're expected to grow by 29%, so over 800,000 new people to our 7-county area. And that does not include outside counties in Wisconsin and the St. Cloud area. So it addresses the fact that if we do see that population increase, we'll need to add 13,000 new housing units every year. It also addresses the fact that we're anticipated to grow by 32% when it comes to jobs, so that there will actually be a gap, and that has implications for equity and how we train our current workforce. It acknowledges the fact that we have limited financial resources and we don't have enough resources to actually maintain or expand any of our infrastructure, so we'll need to begin to think differently on how we use that infrastructure. And of course, we know that populations are changing. By 2040, it's expected that 40% of the population will be people of color. Currently, that's at 24%. And also, our population will age. So by 2040, we'll have 20% seniors, where we're at 11% currently. Thrive also acknowledges the fact that there's, there's environmental changes and challenges, but that we have an opportunity to approach some of these challenges ahead from a regional approach. Thrive 2040 does one thing that I think is different than its predecessors, and that's really to establish 5 outcomes and 3 principles. And these are really interwoven throughout and really drive the plan. And I think this is really smart on the behalf of the Met Council. The 5 outcomes are stewardship, prosperity, equity, livability, and sustainability. And so the Met Council says they recognize that these 5 outcomes reinforce and support one another. It's really a comprehensive approach. And that supporting one over another doesn't work. All 5 need to be addressed in plans, policies, and projects if our region will move forward in a positive manner. And the 3 principles of integration, collaboration, and accountability, that's really the how of the plan, so how they will accomplish the 5 outcomes. Now, when we look at state statute, it's rather confusing and inconsistent. So what's laid out here are the bare minimums of topics that must be addressed by cities, counties, and the Met Council. You'll see there's some alignment. There's quite a bit of difference between the 3. But I think what's important to note is that these are just bare minimums and just the bare requirements. I think best practice, and kind of what Andy mentioned before, is that many communities go above and beyond what is listed here. This is the current 2040 map of community designations for the region. And community designations are used by the Council to guide regional growth and development to areas that have urban infrastructure in place and the capacity to accommodate development and redevelopment. And they really establish land use expectations, including densities and development patterns for these various communities. And they outline the respective roles of the Council and the individual communities and strategies for planning for forecasted growth. So the one big difference from the last 2030 plan is mostly seen in the urban core. In the past, the urban center was really only considered Minneapolis and St. Paul, and you'll see here that now a number of first-ring suburbs have been added to that. You also see that kind of the first and second-ring suburbs are now considered urban, and in the past they were considered suburban. So the Met Council is looking, knowing that we are going to be increasing in population and we have limited resources, to increase the densities in those communities, knowing that we already have infrastructure there, rather than expanding out. I think it's also important to note for food issues, you'll see in Carver, Scott, and Dakota County, that's really kind of the crescent of agricultural reserve. And so if we can move population increases and housing development towards the center of the city, we can preserve those agricultural regions in the more rural parts of the region. So the Met Council does provide resources. They provide some limited financial resources to communities to do their plans. But what they do provide is the local planning handbook, and it's also much improved from the 2030 plan. They provide individualized checklists, data, and maps for communities. So if you go on their website and you work in a particular community, you're able to go to a drop-down and select your community, and it will provide all the data and information that you need. You can also get maps. It'll create maps for you that you can copy and paste and put into documents, whether it's your comprehensive plan or other documents. Provides information on the planning elements. That's things like transportation, housing, economic development. And then also provides local planning highlights. So great practices that people are doing within our region. So I'd encourage you to definitely take a look at their website. It's very helpful. Then I want to switch gears towards looking towards the future. And kind of joking here that we are in the future. You know, we're a number of years into our 21st century here. So in note to all the things that I provide here, I think it's important to look forward to the future. We've also looked back at the past, and I think that's also really important to do. What I don't want to come off as sounding is that I'm suggesting to throw the baby out with the bathwater. So I think there's a lot of practices and information that we can use from the past moving forward. So it's mostly about using this tool that we have of comprehensive plans and tweaking them to be the best that they can be for where we're at. So in regards to planning elements, I think in the 20th century, you know, as Andy mentioned, just years ago, the number of topics that were covered was much shorter. And moving into the 21st century, we have those topics. In addition, we have health and equity, sustainability, resiliency, and food, just to name a few. That list is probably going to continue to expand. I think process is changing as well, and this was alluded to as well earlier. So what's listed here is kind of a mix of required and suggested steps of the process, which begin with a visioning and end with adopting as an official city document, and then amending as necessary and updating the official controls. I think most of this holds, and some of it, as required by law, has to. What I think is important is that when we look at engaging communities, that is what's changing, knowing that our communities are changing. I think some communities have really thrived with a policy of take it to them, so not just holding public open houses at City Hall, but actually taking meetings to communities where they live and work. I think the internet is an awesome tool and something that we can use. You know, I think about just 10 years ago, for the last go-around, the majority of us didn't have tiny computers in our pockets or in our purses, and we should use those during this process. I also think with our changing demographics and a need to focus on equity in our planning processes, that will really change the way that we do planning. I think form is changing as well. What has been outlined in the past is a background chapter, and that really provides the information and data that sets the stage for the rest of the plan. The policy chapters, those individual planning elements, and then an implementation chapter that talks about how the plan will actually be implemented. And I think that this general format still holds. But I think what is included in those is very different. I think a values-based approach is a very smart way to go about things. I think that's what the Met Council has done. I think it's a much easier way to get everyone on board and to build consensus when we're talking about values rather than specific projects or what will happen with a particular street or a particular parcel of property. Really being goal and outcome-based, I think, is really important, as well as measurable, to know how we're doing with progress. You know, are we achieving what we're setting out to do? And when we say things, you know, like increase the number of bike lanes, well, you know, I think 1 mile versus 40 miles is very different. So what are we expecting out of ourselves, knowing that we have limited resources but want to change our communities and improve the health of communities? I think having active over passive language is really important. and I think that's tied to being goal-based and being measurable. Many communities in the past have used rather passive language, which I think is done somewhat on purpose, maybe not wanting to put themselves out there too much, or wanting to kind of give them a way out in case they're not moving things forward or not able to move things forward. But I think putting forward active language really sets the stage and the kind of the shared agreement amongst community members and government that this plan will be worked towards and accomplished. And then I think approaching things on a comprehensive manner. You know, as Andy mentioned, transportation doesn't happen just in a silo or in its own chapter. So how can transportation be infused into land use, into economic development? And when this relates to food and health and equity, I think we can look at like a tree of comprehensive planning. And I think food can be its own chapter, its own branch, or it can, or it can be acknowledged in the variety of other planning elements. I also think food, health, and equity could be included at the roots of this tree and really be either an outcome or a principle. I think that's really up to your own community. I think function is really important too. I don't think all comp plans have sat on a shelf and collected dust, but many have. Many maybe have not been utilized to their full capacity or extent. And I think it's important that we no longer do this and we make sure that we're really utilizing our comp plans. I think one way to do that is to be outcome-oriented and measurable. I think another way to do that is by putting the comp plan in its rightful spot, which is really kind of the document of a city that really has the vision and how that vision will be achieved. I think it's also done by really taking a look at having the comp plan in place and then having it influence the official controls, which are things like the zoning code or the subdivision code, looking at the capital improvement program, which is a community's major expenses and investments in its infrastructure, and then the annual budget and strategic plan. I think if the comp plan can serve as an umbrella document that really filters down to all of these other documents, and they don't happen, you know, kind of in a vacuum. So I think the strategic plan can be a tool looking back at the comprehensive plan on an annual basis or a number of years to look at, okay, we have this 10-year plan. Now how can we break this out into a work plan over those 10 years? And how can we strategically begin to address some of these issues? I think accountability is going to be really important moving into the future, and I think that's a word that sometimes scares people, but I think it's really important knowing that we have limited resources, that we really need to be good stewards of those dollars and of that staff time. So I think the way that we shape our comp plans needs to be more accessible so that community members are able to really digest what's in there and know whether or not their government is doing a good job and is achieving what has been set out in those plans. I think this helps to reduce frustrations as well, knowing that maybe governments are doing a great job and maybe that the general shared vision for the community is not what an individual angry neighbor might think it is. And now this is actually specific to Minnesota. It outlines how laws at the local level are created and how much flexibility is provided by our laws. You'll see the comprehensive plan is at the very bottom, and so it's the opportunity for a community to really provide an opportunity for people to provide input, to really kind of flex their muscles when it comes to the law. As Andy mentioned, a judge will look at a comprehensive plan typically before a zoning code. And so I think it's really important that the comprehensive plan be the document that it can be, knowing that it really sets the groundwork for these other plans, and it has the most flexibility when it comes to the law. I think it's important that a community really has a strong foundation moving forward. So now I really want to do a call to action here. I think it's important that we really truly embrace the 21st century. We can't keep doing things the same that we've always done them and expect to get a better outcome. We have to change, we have to adapt. And I don't think that's a bad thing, and that it doesn't negate any of the plans in the past. It's just an acknowledgement that times are changing, and so we need to change the comprehensive plan to keep up with the times. I think making health and equity either outcomes and or principles of the plan is really important. After all, planning and health are tied together historically, and if you ask most planners why they got involved in planning, it was to improve their communities. And ultimately, that's about improving, people's economic health, their physical health, their social health, their mental health. I think it's a really great opportunity to build partnerships between public health, community organization, advocacy organizations, and City Hall or our county buildings. And of course, to be accountable and transparent. I think we need to move forward at a faster clip than we've been doing. When President Kennedy said we're going to go to the moon, we made it to the moon in 7 years. So, I think maybe that's a little bit of a stretch, but I think we can accomplish good things and great things if we really hold ourselves to be accountable and we're transparent about the progress that we're making. So I just want to leave you with this quote, and I apologize that it's not gender neutral. It's a Greek proverb that says, "Society grows great when old men plant trees whose shade they know they will never sit in." And I think that's really important, especially knowing that we're planning for the year 2040, and some of us might not be around for then. And so how can we leave a legacy that's better than, leave a legacy and a community better than how we found it? So I'm going to pass it back to Mary for some more information and then to open up our questions and answers section.
Great. Thank you so much to all of the speakers today. And before we move to the Q&A period, I did just want to give a little plug for the next webinar in this series. We kind of conceptualize this webinar series as a way of providing some building blocks to within local government staff and public health advocates, to explore ways to partnership and to move our communities forward in addressing some of the chronic health issues that we're struggling with and we're trying to find a path through. And so the next webinar in this series is going to be looking specifically at how to integrate food access into local planning efforts. And this webinar in June is going to be actually using the Food Access and Planning Guide as a frame of reference for the conversation to provide some concrete examples and to talk about some work that's been done through Blue Cross Blue Shield, Center for Prevention, and a number of stakeholders around the state to really think creatively about how to build food access into some of the local planning efforts that are happening across the state. So please put that on your calendar and stay tuned for that webinar. We're really excited to have the Food Access and Planning Guide to share with you at that point. So now I want to move to questions, and let's see, we can take folks off of mute. And I think that the first question is directed to Andy, and the question was specifically, what kind of health-related data did you share with the cities that you were working with? And were there any specific types of health-related data that those cities found to be compelling and useful in their planning efforts?
Well, we used our public health partners to present that data at a committee meeting, and I'm not exactly sure what the whole list of. They went through a whole bunch of things, but one thing that we do use often is our Bridge to Health survey results, and they're very, community specific, and some are regionally specific, so people get a good picture of their area. The other thing that we discovered that people really, at least in Northeast Minnesota, kind of looked at was county rankings of different health factors and area rankings, because I think a lot of people in, I don't know if this is the case for all of rural Minnesota, but at least in Northeast Minnesota, kind of felt like a lot of the issues that we talk about health-wise are, oh, that's a metro problem. That's a metro problem. You know, rural Minnesota, we're active, we're out here doing things. And they discovered that a lot of the counties in Northeast Minnesota are very poorly ranked in the whole picture of the state when it comes to different health factors. And I think that opened their eyes a little bit, that rural Minnesota has a lot of the same problems that metro does, or maybe even more in a lot of the cases of these different health factors. And I think the obesity rate statistics really grab people as well.
Great, thanks, Andy. I just want to check and see if Eric or Ellen have anything to add to that before moving on to the next question.
I do not.
Yes. All right. If not, there's another question that came in that says, for a moment, let's assume that the comprehensive plan, turns out great and highlights health and food. The question is, how would you suggest that the public can stay involved with the results of the plan that they had the opportunity to shape? And so this, I think, gets into implementation and what are the best ways to keep the public involved in the implementation of the plan. And why don't I turn I'll ask Eric if you want to respond to this first, and then go to Ellen and then Andy.
Sure, yeah. So exciting to think, yeah, we got this awesome plan. Now what? And unfortunately, the real answer is that the work is not done. And really, you're never done doing a comprehensive plan or implementing a comprehensive plan. So I think one thing really important is to include those metrics. How are you measuring whether or not you're making progress? And get the community involved in creating those metrics so they know what it says and they know what the community is striving to get to. I think, you can look at maybe your governance structure, and maybe there's a commission, maybe a new city commission needs to be created on food or health or equity, or maybe you take an existing commission and change or add their charge to include those issues. That kind of builds it into the regular operations of the city, and then there's kind of an appointed body that holds those topics near to their heart. I think the strategic plan, if you don't have one, you should. And if you have one, it should be connected to what's in the comprehensive plan. And I think one thing that communities can do is an annual report. Many cities do a state of the city or a state of the county. And I think going back and looking at those metrics and seeing how far the dial has been moved, how many projects have been accomplished, and to have that level of transparency to the community saying, this is where we're making progress, and say, this is where we're not making progress, and here are the reasons why, and here are the ways that we could build partnerships with community members to make progress.
Great. Thanks, Eric. Ellen, I didn't know if you had anything to add to that?
I think Eric kind of laid out a really good vision for participation. I would just add, communication, and as projects or activities are implemented, continue to link it back to the community's comprehensive plan, or acknowledging that connection.
Great. Andy, anything else you want to follow up with?
Well, we do recommend and typically in our plans is that the community have an annual comprehensive plan meeting after they've adopted their comprehensive plan, where they go through the things that Eric was talking about and seeing how many things they've been able to implement, and if they want to add anything else to that, or if something changed in the community that warrants another discussion. So we seek that annual review of the comprehensive plan in our small communities. And we also try to get the word out there about different things going on, and try to find somebody that's willing to champion something. We've had some success with recent developments up in Lake County with mountain biking, for example, where we were able to find people that were really into mountain biking, and they've agreed to, champion this process through, and we're making a lot of progress. So hopefully you can find that one person that can grab something in a rural community. Sometimes that's all you can hope for is one person that is super interested in something and can make it happen. Otherwise, it's really up to the city council yearly to see that things are moving forward.
So kind of related to this implementation question, I was just wondering if you could respond to, what are some of the biggest challenges, or where comprehensive plans run into problems with implementation? Ellen, you want to take a first stab at that, or you might want to think about it for a second? I know that from communities that I've talked to, that people want to be invested and take time in developing this plan, but then they're also concerned that that nothing's going to happen. It's just going to, like Eric was talking about, sit on a shelf. Sorry, go ahead, Ellen.
Let's see. I would say probably prioritizing. Looking for the first opportunity to implement what's in the plan, so you can kind of get the ball rolling on, having some first successes. It's always one way to, kind of one way to get to implement your community or comprehensive plan quickly. So, just having that strategic plan, as Eric said, is really key. So planning out what you want to do first, and kind of getting started. That's
great. Now, Eric, do you have any other follow-up about what some of the challenges with implementation might be?
Yeah, I think there's a ton. I think limited resources is probably the biggest one, and there are going to be ways that can be overcome, but a lot of ways I think people's hands are tied, and so it's looking at how to use those resources more effectively and more efficiently, building public-private partnerships, and really looking at timing. I think timing can be key too. Not everything, it's a 30-year plan, so not everything needs to happen in year one. And so how do you phase things in? How do you phase things out? Don't get too overwhelmed, I guess I'd say. Give yourself a little leeway there. And, look to others. I think there's lots of great examples out there. I'll make a pitch for the American Planning Association. Their monthly planning magazine, the March edition, was all about 21st century comp planning, and some cities that I think we wouldn't expect to be doing some really innovative things are doing innovative things. Houston and Nashville were on that list. Nashville just won the annual award for comprehensive planning, and so take a look at what others are doing and how they're doing it. I think people are really doing their process differently, and I think that's where we're seeing some innovation and some accomplishments.
Right. Andy, do you have anything else to add from in more rural Minnesota, what some challenges might be with implementing plans?
Well, I think all of us planners have war stories on this type of thing. I just had a community that approved their comprehensive plan, and it talked about making sure that sidewalks are part of every street construction and street reconstruction, and it took them all of a month to vote against a sidewalk on a street due to public pressure from a variety of sources. So I think that's, it's easy in a comprehensive plan, which is generally more general, to say we're going to do this, but when it actually comes down to a city council made up of neighbors and people that work and live in the community to stay with the comprehensive plan's recommendations in the face of public pressure, there's always going to be a challenge. I will say that the same city council the next month didn't bend to the community pressure and did vote for a sidewalk project. So, it always comes down to people and moments as you're implementing these things, and you have city councils that change, you have mayors that change, you have staff that changes, and maintaining the comprehensive plan's vision through those changes can be challenging.
Oh, that's great. I want to ask, like, one other, before we wrap up today, there's been a lot of conversation, I think, in Minnesota recently about health inequities and racial disparities we're seeing in the state, and people are really wanting to grapple with how to address those and how to move Minnesota to a more equitable community and respond to the needs of those in greatest need. And I was just wondering, and Eric, I think I'm going to start with you. I was wondering if you could just talk a little bit, or your thoughts about how a comprehensive plan can help provide a framework or a vision for addressing some of those health inequities and disparities that we're seeing here in Minnesota.
Yeah, I think one, it's a small change, but I think it sets the stage for larger discussions, and it can change the tone of a comp plan, and that's really the data that's included. I think sometimes the data can be pretty straightforward or presented pretty straightforwardly. We have this many people now, we're expecting this many people in the future. We have, this percentage in poverty, we have, this percentage of youth. But diving into what does that actually mean? What does it mean that the community's demographics have changed and are going to continue to change? What does it mean if you have a really young community versus a really old community? And then how can you, begin to address some of those things? How can you address the poverty rate? How can you, measurement? How can you cut it in half or work towards cutting it in half? And then it's all about, implementing the individual planning elements. And I think the most important one, or important two maybe, can be health and economic development. The biggest indicator of your health is how much you take home in pay. And so how can a city really put all of its, effort forth in improving economic development and for all the people? I think, it's about changing the tone and changing the, the weight, where are you putting your weight and your effort behind? And that might mean doing things differently. So I think a recognition that really nothing's on the table. I think that anything can be changed, and that any program that exists may need to be cut or may need to be changed.
Great, thanks. Ellen, did you have anything you wanted to add about thinking about equity and how plans can help respond to that need?
I get Eric said it well. My thought was just during the engagement, making sure we're asking who's not part of this process or who's not being part of this process. So we get more input from everybody. So then hopefully the policy recommendations are more inclusive. That would be my main thought.
Thanks, Andy. Anything else?
Well, in Northeast Minnesota, we have a pretty ubiquitous aging population, so that's always something we're dealing with, and it maybe is a little less diverse in our inequities than the metro. But I think some communities are always surprised to see some of the statistics of poverty rates and things in their communities. So it's something rural Minnesota deals with as well.
No, and I think
one other thing. I'll add. I think one thing that's really important is, knowing that these plans are being created for 10, 20, 30 years in the future, thinking about who is going to be the community in 10, 20, or 30 years. I think engaging youth can be really important, and they're kind of they are what the community will look like in the future. And so asking them what is the kind of community that they want to live in, and what's important to them. And I think they can be a little tricky, right? Like, I think they don't quite have the grasp of how government works, but that can also be really freeing. They don't have some of the baggage that the rest of us carry around of like, well, that doesn't work or that hasn't worked in the past. So going to, you know, like Alan said, making sure that your community engagement process includes people that typically haven't been at the table.
Thank you all. One other question came in while we were talking, and Andy, I think I'm going to ask you to respond to this first. It's, how do you deal with community input and at the same time use research that may show that something different than what people think is actually the best strategy? And I think you kind of talked about this a little bit with people's perceptions about health in more rural communities.
Yep, you know, we talk about what we know in the research and the data and what their survey results were. It's always interesting to see a community survey results and what they perceive the major issues are compared to what our research has shown. You lay it all out there, and in the end, it a lot of times does come down to what the community wants to talk about, because it's really their public input plan in this case. But we put it out there, and we as planners, professional planners, it's our job to inform people of what's going on and to help them with ideas as to how to address those things. I don't have a magic answer to the question, but it's something we balance quite a bit, and it's something we're used to doing.
Eric, do you have anything to add to that?
Yeah, I don't think there's one silver bullet to any of this, but I think overall, you know, for comp plans, I think what is really important, and maybe I think we lose sight of sometimes, is that all of this work is about people, and it's about our neighbors and the people we see at the store. And so if we can really hold this up as a document and projects and plans and budgets that are all about people and not about politics or, you know, all the other things that we get wrapped up in, I think that'll change the way that we see things be accomplished. You know, I think it's much harder to get up and rail against a project if you know it's about improving the way that our community members live and operate. I think including people's voices in plans, you know, I think I've been talking to one community about how do they include individual stories about, you know, this is X person who doesn't have a car, and this is how she gets to work, and this is how she gets her kids to school. I think that can be really powerful.
Great. Well, I think that is a really nice way to wrap up the webinar. I think that we're at 1:30 now, and I just want to thank Andy, Ellen, and Eric for your contribution, and everyone for participating with us today and for sticking with us. And we look forward to talking with you in June about food access and planning.
Thank you.
Thank you.